delicious bread. And I just want to make space and time and acknowledgement for this is like the space that our neighbors come to every single day to receive services. And it's an honor and it's a privilege to have a conversation in that space. There's also some artwork over here to the left that our lovely clients have curated for us. And yeah, so please get some pizza, get some snacks, get some bread, and prepare yourselves for this very necessary conversation. It's so necessary, and our bodies definitely need to be nourished for what we're about to discuss. And we will get started shortly. Thank you so much.
Join the fun with the Golden Pink family.
A controversial practice. A controversial practice. Bear County is the only place in Texas where needle exchanges are legal. Some say the exchanges save lives. Others say they enable drug addicts. Tonight, we take you inside a homeless camp for a raw look at life in the grips of addiction and the team on the front lines trying to bring them home.
Hey, it's Cody.
On San Antonio's south side,
Always announcing that we're here, letting them know in advance.
you'll find Cody and Scott.
How you doing, bro?
They're part of Corazon, San Antonio's harm reduction outreach team.
This is reality. This is the reality of what's going on. You can't tuck it away. You can't lock it away. I was there where you at.
Their effectiveness on the streets, their gift, is their own pain, personal battles with addiction, now channeled into something different.
I'm comfortable coming out here because I understand these people's struggle.
During the week, the outreach team visits homeless camps across San Antonio, handing out safe injection kits, toiletries, offering peer support, and building relationships.
In this camp alone, right? You know, each one of these are human beings that are somebody's children, somebody's sisters, uncles, cousins, nieces, and nephews.
The team swaps out dirty needles for clean ones, distributes Narcan, and treats wounds.
I practice compassion because we are all human beings. We all have made mistakes. So we take care of a lot of wounds that are caused usually by missed injections when they miss the vein that they're trying to inject.
For some, the idea of handing drug addicts clean needles is controversial. But for people like Cody, the logic looks different.
If somebody's dead, then recovery is impossible.
So we're on the southwest side of San Antonio, and we are in the middle of one of the encampments that Corazon Ministries comes on out to. This is where they do their harm reduction. This is where they do their outreach, and this is where they make the most impact.
During the light of day, the camp was calm, quiet. We were invited in with the outreach team.
You know, you have people, like I was saying, who've been living back here for 7 and 8 years, and they look out for each other, right? They also can be each other's worst enemy as well.
Scott and Cody have both called camps like these home and explained what it's like to live there.
The beast comes out in people, man, when they don't have what they desire on a daily basis, and their bodies are desiring a substance that has them doing things that are out of the norm. So they may rob and steal from each other, right? You know, females get raped out here, males as well.
A dark reality, but there's humanity here too. People who have lost their way, just trying to hold on. Like this man, he waved us down, wanting to talk and sharing his nickname.
Rock and roll.
Do these guys help you out? Yeah, they bring stuff. Yeah. Full water glimpses of humanity.
Even though that they're out of sight, to us they're not out of mind. It may be just that one day that we show up that they're ready to go, and that's what it took for me. It was just that one day, and since then I've never looked back.
Moments of grace, breaking through the grip of addiction.
By us coming out, we open that dialogue because we speak their language. We have a youngster in the van right now that's going back to the day center with us and to our harm reduction hub, and we're going to attempt to get him into detox and treatment today because he was ready. We engaged with him numerous times, and so today he came to me and he said, "I'm ready. It's my time."
What does that feel like on San Antonio's south side?
It's an amazing feeling.
Simone Gialba. The Bexar County Needle Exchange is paid for by the Bexar County Commissioners Court, Metro Health, UT Health, and federal funding. Since it began in November of 2021, over 1,500 people have been helped.
Welcome, everybody. My name is Madeline Santibáñez. I'm actually the director of the Corazon harm reduction team here at Corazon Ministries, and a lot of my staff are here, so I just want to acknowledge the team behind this beautiful work that we do. It is, we've completed our first year since we opened up the drop-in center and our outreach initiative, and so far we've collected over 158,000 syringes off the streets, distributed over 7,000 doses of naloxone. We've reported over 1,530 overdoses in our community, with over 35 outreach locations throughout the city of San Antonio. This year alone, we did over 2,800 wound care kit distributions and safe injection kit distributions, tested over 150 clients for HIV, HepC, and syphilis, and have completed over 1,966 community referrals to emergency shelters, housing, sober living, detox, medication assistance treatment, residential, and outpatient treatment programs. So, a round of applause for our harm reduction team one more time. It's a blessing to do this work. And I want to welcome you to the Corazon Day Center. It is the only homeless day center in the city of San Antonio. We're open Monday through Friday, 9 to 3 p.m., Monday to Thursday, and close a little early on Fridays. We close at 1. But we provide showers 6 days out of the week, hot meals, breakfast served around the corner, lunch served here every day, and we have our housing case managers right inside the day center. So at any point our clients want to get on the housing list or are desperate to get off the street, we're here for them. So welcome to our space. Again, it's an honor to have you here. And a lot of our clients that are volunteering, shout out to Ethan and Jose. Thank you so much for holding it down. We love you. And now, without further ado, I would like to introduce our panel moderator today, the Executive Director of Black Freedom Factory, Ms. Camilla Factory. Thank you. So Ms. Camille Factory is actually the founder of the Change Rape Culture initiative, as well as co-founder of Circles in the Hood that engages at-risk youth throughout the city of San Antonio in character and leadership development, and is also a part of Freed Texas and their scholars program. So again, round of applause for Ms. Camille. I'm going to hand it over to her.
Testing. Thank you, Mari. That was a wonderful introduction. How are y'all feeling tonight, San Antonio? We are showing up for harm reduction, period, which is the future, the past, and the present. My name is Camilla Factory, and I'm here because I care. I'm here because I see the work that Corazon San Antonio does every single day. For our neighbors. And without further ado, I am acquainted by a lovely panel today of individuals who give their lives to this work. who put their county and the state of Texas on the map nationally for the work that needs to be done for harm reduction. So it is my honor to introduce our panelists tonight. So I'll start with John de la Garza. They are not here. Well, then I'll move on to our lovely Dr. Lisa Cleveland, who is a pediatric nurse practitioner and tenured associate professor at UT Health San Antonio School of Nursing. Her innovative research with mother-infant dyads impacted by opioid use has contributed to changes in clinical practice and improved outcomes. Her recovery residence Casa Mia is a collaborative partnership between the School of Nursing and the nonprofit Crosspoint Incorporated. Casa Mia provides safe and supportive housing for pregnant and parenting women with substance use disorder, where they can recover with their children. She is on the board of directors for Corazon Harm Reduction and helps manage harm reduction drop centers in El Paso, Austin, and San Antonio. Can we give it up for Dr. Lisa Cleveland? Our next panelist is Dr. Monica Dayad. Clinical director for Juaniana Herbolarios, is doctorally trained as a family nurse practitioner, holds a Master of Public Health and Community Health Practice, and has nearly 2 decades of experience as a health worker in rural Haiti and Panama. Monica is a holistic practitioner experienced with clinical herbalism, yoga, Mayan abdominal therapy, and accelerated resolution therapy. Can we give it up for Monica? Our next panelist is Stephen Fiennes Flores, a living experience consultant and STOP program coordinator at University Health. In recovery since December 26, 2016 from substance use, mental health disorders, and Kaposi sarcoma, HIV/AIDS diagnosed in August of 2018, all caused by a rocket scientist idea of self-medicine to keep from feeling anything inwardly while seemingly dancing through life outwardly. Today, by being honest with themselves and great mentors, they are able to use these living experiences to ensure that their voices are heard in places that they would normally not be invited. Through the years, Flores has been endowed with an instinctual ability to network, listen, and develop organic, genuine relationships with people and organizations through feet on the street, outreach, advocacy, and service work to break down barriers and decolonize. Flores does their best to live in constant gratitude and transparency and love of others. This helps them love themselves more and more every single day. If you cannot love yourself, how in the hell are you going to love somebody else? RuPaul, that is their quote for tonight. Thank you so much for being with us, Mr. Flores. And last but not least is our lovely panelist, Scott Dion, who is a person in long-term recovery and is also, coincidentally, the outreach lead for Corazon Harm Reduction. He is a loving father, son, sponsor, and peer recovery coach. Can we give it up for Scott Dion? Before tonight's discussion, I do want to administer a trigger warning for anybody that has a loved one who has experienced living with a substance addiction. And I also want to acknowledge that this space is sacred and it's safe. And if at any moment that you need to leave, or that you need to excuse yourself, or that you need to breathe, that is 100% invited. And that we welcome these kinds of discussions because this is the future and they're hard. And this is how we will move on. Not move on, move with. With that being said, I also want to acknowledge and dedicate a moment to the lives of every single individual who has lost their lives due to addiction and substance use and living with that, because today the point of this panel is to erase that stigma and to cultivate a society that is accepting and loving and understanding. So I want to dedicate a moment to the people that are lost but still lived. May they rest in power. Thank you so much. And we call on our ancestors today to join us in this conversation, this very hard conversation, but necessary. And we welcome all of you. Thank you for spending your Wednesday night with us tonight to figure out how we can move forward as a county, as a city, as a nation in this very pressing situation. So our first question is for all of our panelists. And the question is, how do you define harm reduction? What are the biggest misconceptions and misunderstandings about harm reduction?
Awesome. Thank you. My name is Scott. I'm a recovery coach and the lead outreach for the harm reduction and needle exchange program. So how do I define, right? Harm reduction. You know, when I look at it today, right, you know, ultimately, I see it as a positive platform for change, right? We also get to help them with their health behaviors, right? You know, harm reduction is much more than just a needle exchange, right? That is huge in itself, but it's the compassion that we get to show up with today, right? The relationship that we get to make with them. You know, I often think about this, right? That the relationships that we're connecting with folks out there, that somebody's son and daughter, right? That somebody's mother and father, and they're just like you and I, right? They are you and I. And when I really dig down deep into that, right? What can I do? Can I be consistent, right? Can I put a smile on their face, some way, shape, or form? Can I be a man of my word and come back, right? And that's exactly what I see as harm reduction is today, right? Because they, and I like myself have suffered with that where I've been let down. And so harm reduction goes really, really deep. You know, when we show up to do wound care, and I have an amazing team behind us today, and we all perform wound care. You know, it goes deeper than just that ailment that we're assessing right there at the time period, because in that connection, right, we're putting our hands on them. They're opening up a trust factor with us. They're opening up a trust factor with us. And so, you know, it brings a lot of healing on the inside, and then it starts on the outside. Being able to deliver harm reduction today is a movement in our city that it's bringing the lights back on in the dark spots, big time. Yeah.
Thank you, Scott. A friendly reminder for all of our panelists, speak into the mic. We need to be heard. We need to be heard. Dr. Lisa Cleveland, how would you define harm reduction? More importantly, what are the misconceptions that you face within your profession?
Oh, good evening, everyone. It's so nice to see you all turn out to discuss something we were not talking about 4, 5, 6 years ago when I began this work. So we're making progress, and that is, it's just so exciting to see. When people ask me what harm reduction is, I say it's exactly what it says it is. It's reducing harm. And we practice harm reduction in so many aspects of our lives. I mean, we wear seatbelts. We childproof our homes. That is harm reduction. Does it prevent an accident from happening? It doesn't, but it can reduce the harm that results, right? And for some reason, it's become there's just such a stigma associated with substance use disorder that the whole harm reduction movement, I think, is incredibly misunderstood. I am really encouraged by the efforts that are being made in Bexar County. I really think that Bexar County is leading the state. I know they're leading the state. Other communities are coming to Bexar County to look at the work that organizations like Corazon are doing, and that's really exciting. Several of us were invited to a press event with the county last Friday, and it was related to naloxone, and it was so exciting exciting because Judge Sakai, our new county commissioner, the sheriff, they were talking about harm reduction. I couldn't believe it. 4 years ago, 5 years ago, you would have never heard that. So that's really, really exciting. Misconception, it encourages drug use. That's the one that always catches me off guard because it just, that makes no sense. So I think that's probably a common misconception and the one I hear the most.
Yeah. Okay. So what is harm reduction? How do I define harm reduction? I think it's really meeting people where they're at, respecting everyone's autonomy and their choices for their life, supporting people's needs as they define them. And I think a lot of time public health practitioners, medical practitioners will come to someone with like, hey, this is the blueprint, this is how you do it, this is how to be well. But if you're not listening to someone's perspective and the way that they define their own health and their own wellness, you're not going to be able to actually have any influence or impact in being able to meet their needs. So, I mean, I make a parallel for people sometimes when they don't understand about like, okay, so someone has diabetes, they're not willing to take insulin. That's not something that they want to do. So we can look at, lifestyle changes. We can look at, exercise and finding ways to be healthier. But giving an oral diabetes medication or an herb, making recommendations of certain foods that someone can eat that, traditionally keep blood sugar more balanced, doing things like that is reducing harm. So if someone's not ready to, be injecting insulin every day and taking that kind of step in their life, then there's things that we can do that reduce harm to their bodies so that they can be more well. And then misconceptions. I think it's just really, like the stigma that's associated with people who use drugs really gets in the way of understanding how medically necessary so many of these interventions and ways we have to support people are for their well-being. So it's really just people's fear that gets in the way of understanding how important these things are. So, I mean, I think, to be fully honest, the first time I heard about syringe exchange as a public health practitioner who considered myself very open-minded, I was a little bit nervous. I was like, oh, wait, but how does that work? Like, what could be the potential harm that could come just because you think, if you don't know, you're going to wonder. But through my work with Yanawana and seeing people, coming and realizing there's that many fewer syringes on the streets for people to be able to, get an inadvertent needle stick and have transmission of HIV or hepatitis, and realizing that relationships that we build with people as we're, meeting their needs exactly as they're defining them for us, over time, we're able to, find ways to improve their health and reduce harm to them. And so, yeah, people think that it's this kind of edgy, really out there thing, but it's actually just a medical need, and it's just a health need that we're meeting by asking people what they need to be well with the way that they're taking care of their own health and as they define it.
Good evening, everyone. Thank you for allowing me to be here. This place is sacred to me. And as far as the definition, the question is how I define harm reduction. Wow. Harm reduction for me, as I've recently learned, is something that way back when I was a little child, I wish, it was something that society has these ideas and these recipes and these ways of being and doing things that are very hurtful if you don't fit in that, if you don't fit in that square or you don't fit in that circle. And, you know, being the first child of my mom, I mean, you know, to, I think they're second generation Mexican, and the responses that they had, that they received when we'd go out, and they're like, "Oh, your daughter is so cute," and it'd be like this embarrassing look for my dad, and it'd be this very, you know, like just this crazy look, and so on my mom's part, and so it made me feel very jaded. Had there been some sense or some knowledge about harm reduction, you know, we would break down those barriers and break down that idea that somebody knows the right way to do something. So for me, harm reduction is about going really deep into where, you know, where my mindset came from to think that, you know, it was okay to put a needle in my arm because that's what made everything, all those feelings go away. And harm reduction for me is about really taking a look at each individual, respecting their words, respecting their life, and letting them teach me something. Because that was not what was done when I was being raised. Nobody was looking at me and saying, what can we learn from this little child? They were saying, what is wrong with this little child? And parents who are not from here, well, they're second generation, so they're kind of from here, but they're still they grow up with this like mentality of, you know, being abused verbally, emotionally, mentally by people who were white in the areas that they were raised. So they just have this sense of inferiority, and so when that you know, so it all goes back to this decolonization that's necessary. And so for me, that's what harm reduction is. That's the definition of harm reduction for me. And I'm still learning. Like you know, I'm the new kid on the block, but I'm on fire. Yeah, I am so grateful for this life that I've been able to be a part of, and the thrill of living for real and not behind some needle or some, you know, persona that I think I am. So that's how I define harm reduction. As far as a misconception, well, I mean, it's all rooted in ignorance. You know, what people don't know, and I'm not calling anybody a name. It's just a lack of knowledge. It's just real simple. You know, the more I talk about my truth, you know, do I go into all this now, or do you want this later? I don't know how many questions there are. You know, so the misconception is that it's enabling. You know, well, people that do drugs are going to do them whether they get a clean syringe or not. And I'm living here to tell, you know, I used a bad syringe. And because of stigma, I had, by the time I finally went to the doctor, I had HepC sarcomas, which is a full-blown AIDS diagnoses. And, you know, and that sense of enablement, that ignorance is all rooted in fear and stigmas, and that's what kept me from going to the doctor early on. So the misconception that it's an enabling, no, we need to talk about it to break down those barriers and break that stigma that exists in our society that was really just to colonize and put people in cages and make them look some kind of way and build barriers of fear around different groups and types of people. So the misconception is that we're enabling people to use drugs, and it's all rooted in ignorance. That's more questions?
Thank you, Stephen. And
just thank you for everybody being here, right? Like I want to believe that everyone in this room was, thank you, Scott, were like intrigued by this conversation and just stumbled into a DreamWeek event. But because I don't believe in coincidences, I know that everyone in this room were impacted in some way or another by stigma, by this thing that Dr. Lisa Cleveland just identified as harm reduction over several years. And this is not an easy conversation, but it should be. And we're here so it can be. Because the future is acceptance. The future is love. The future is understanding and forgiveness. And that is all a journey. So with that being said, Dr. Lisa Cleveland, I will ask how UT Health and other stakeholders have done this past decade to support harm reduction programs and resources in Bexar County all around the state of Texas. How does that frame the future of harm reduction, period, throughout the nation?
Ooh, that's a tough one. Yeah, I have to think about that a minute. I think having an academic institution involved in harm reduction is probably relatively rare. Particularly, I would think looking historically, it's pretty rare. I see myself as a nurse. I'm a nurse first. I've been a nurse for years. Since I was 4. It's what I've wanted to be. And so as a nurse, we are very, we care for the community, the public. And so to me, this work made perfect sense. Right. I had a little trouble at first explaining it to my former dean, but decided it was better to ask for forgiveness than permission. So, but things do change. They do, and I am seeing that happening. Again, 6-7 years ago, my work really began with women and children. I'm a former neonatal intensive care unit nurse. Haven't really worked in the NICU for probably a decade, and at that time had taken care of a few babies who had been born prenatally exposed to opioids, so they were born experiencing withdrawal symptoms. We sometimes refer to that as neonatal abstinence syndrome. So I cared for a couple of babies, but not many. And when I came to San Antonio, the Bexar County area, I didn't know the community very well. I was in a doctoral program at UT Austin and doing my research focused on the experiences of mothers who had infants in the NICU, because it was something that really fascinated me. I didn't feel like we took very good care of our parents. I mean, we took great care of the babies. We kind of tolerated the parents. Even though we were nice to them, we really saw a role as caring for the babies. And having become a mother during that whole experience, I started really identifying differently. I started to really understand what parents were going through. And so anyway, here in Bexar County, I kind of came across in my data collection, had started getting so many calls from women who wanted to participate in my study who had infants in the NICU for neonatal abstinence syndrome. And I kept getting call after call after call. And I remember thinking, what on earth is going on in Bexar County? Why are there so many babies with NAS or neonatal abstinence syndrome? It was so puzzling to me. But this was back in 2010, so it was kind of right at that turning point where we started to recognize that we have a serious problem in this country with opioids. And so I finished my dissertation. When I got done, I just really, the stories, the women, I mean, for all of the moms, the NICU experience was incredibly stressful, right? But for this particular group of moms whose infants had NAS, they were dealing with a whole bunch of other stuff, barriers, stigma, discrimination. Nobody was talking about it. I went to the literature and I found some research on NAS, but it was really focused on which are the best medications to manage the baby, right? What clinical trial, what medication. Nobody was talking about the parents, the moms. And, just this horrible shame the women shared to the point where they were so poorly treated by healthcare, the healthcare system in general. Some women just decided not to even go back to the nursery. They just said, you know what, I can't do this. I'm not even going to go back. And so that is changing. Again, things do change. You know, that's been 12, 13 years ago. We are talking about it more. We are developing better models that support the mother-infant dyad, which is really exciting. So I think I went off on a tangent. Did I answer your question? Okay. I don't remember what the question was. Oh, academia. Yes, academia. And so I have to share with you, and I think I've shared this with Bree. Bree is a doctoral student with my team. The very first time I went to present so I was doing a qualitative study. So I was interviewing women. They were telling me their stories. And I was writing about that. And I went to one of the premier like nursery, neonatal nurses type of conference. And I was presenting some of my preliminary data, and that room was packed. And I still remember this. There was a group of nurses who sat right in the front row. I refer to them as the mean girls. They were not having it. I couldn't believe it. They were not having it. They didn't want to hear anything about the moms. And towards the end, one of them raised her hand and she said, well, do you know what these women do to pay for their drugs? Like, she wanted me, it was awful. It was really, really awful. But again, that was 12 years ago, and I think things have gotten better. So that gives me hope.
Thank you. And you still remember that moment, right? Like, it was like impactful. And hate,
yes,
sticks.
Yes.
Like, stigma sticks. And I just like wonder where she is today. She's not here. So
clearly not here.
Anyways, with that being said, I do want to remind folks that there is food at the back. We are in the later hours of the night. Please provide your bodies with some sustenance, which is pizza of the hour, as well as bread and hydration. Scott, I'm going to pivot on to you. I definitely think, I know that we're scratching the surface of a very important conversation. And I also want to thank you because the work that you're doing, you're a pioneer, right? Like, you pioneered even the existence of the Harm Reduction Center that Claudia and Madeline and Scott and Abe, like, foresee every day. So thank you for seeing that. Scott, I want to ask if you have a personal story that you want to share that sticks out to you, that touches your heart in terms of the work that you've done with harm reduction, or even just as a human being with your journey. Because here tonight, we're not, and I understand it's intimidating with the table and the tablecloth and the DreamWeek like banner or whatever, but this is a safe space. It does not matter where you come from or where you're going. All that matters is that you're here right now, and your experience is valid and it's welcome. So Scott, do you have any memories that you want to share with us?
Absolutely. Mm-hmm. There we go. When I think about my personal connections that I get to, and I cherish them so much, right? I look forward to it when I wake up in the morning. I know the schedule, right? I know where we're going to go, and I look forward to it. And I can envision their faces when we go out, and I'm always looking forward to meeting somebody new. Right. There's so many new outreach strategies that over the last year that we've got to practice, repractice, and perfect. Right. I don't think that we'll ever perfect it, but we're always going to make progress. Right. And, we're just scratching the surface with this. Right. We're just getting started. Right. And it's exciting. It's more exciting for them. I'm just grateful to be a vessel, to be here and to be a part of it. And there was on New Year's, we had the opportunity, either we were going to work or take that day off. And substance use doesn't stop. It doesn't stop. Morning, noon, and night, 365 days, right? Working overtime. And so I was given the opportunity to go ahead and load up and go out that day. And I was just about to leave a spot on the southwest side of San Antonio. And this big old tall man comes running up to me, right? And he's got tears in his eyes. but he's also got a smile on his face, right? And he's like, Scott, I want to thank you so much, right? Because you and your team coming out here, right? Out here in the middle of the woods and bringing harm reduction, bringing the supplies, right? Bringing Narcan. I'm alive today. I'm alive. And so I sat there and we had a long conversation, right? He had never overdosed before, right? He'd been using for X amount of years. And as I sat there and talked with him more, right, I come to find out he's a musician. He's been on TV. The pressures of life got to him and he's just wanted to go and lay it down and take it easy for a while. Substance use attacks at every angle, not just the poverty, with everybody. Life is tough. And when it's not properly, you know, when things aren't addressed, some of us, we can go to meetings, right? We have sponsors and we have counselors and we have therapists, right? But when you don't have that at hand right then and there, man, at a turn of a dime, right? And I don't mean to make it a cliche, but there's dimes everywhere to be bought out there, and they take away the pain, right? Yeah, you know, it's just the way I roll, right? I love getting to do this. It was just on Tuesday this week. Two of the doctors got to go out with myself. I got to go with them, and we were going around and we were doing wound care. Right. And I was let know the day before. So hurried up and formulated a little route in my head. So therefore we can get to as many people as possible throughout our route from northwest, east, and south side. Right. And at one of our locations that we visit quite often, they're running into some trouble. Right. They do live in house, but they keep getting warning after warning after warning about the cleanliness of the spot, and they're not really doing anything about it. But because we show up all the time, we always show up, right? They see that we love them, right? And the week before, I had kind of pulled the guy to the side and held him accountable as a loving accountability, right, about cleaning up. And so when we showed up this Tuesday, right, the whole front porch was clean, right? You know, the aluminum foil was off the windows, and these are little differences that we get to make because of the love that we get to make as we make this connection with them, right? That we have their best interest at heart, right? And usually they're not very open to other people, right? Putting their hands on them. You know, when I talk about wound care, I mean, I'm very passionate about it because I see the difference that it makes, right? And so the husband had gotten a blood infection about 4 months ago. I don't know whether it was, we have no clue whether it was a substance that he was using or something else, right? But it ended up affecting his heart, and he had open heart surgery, right? Well, him being, dependent upon a substance, wasn't given enough medicine while he was there, so he decided he needed to go home, right? Sick of mama, sick from wanting more substances, right? Well, he ended up back in the hospital. So he's going through a septic stage right now, right? Very septic stage. The substances that's being distributed out there right now, man, is really having people numb to self-care, numb to their the way that they're living, the way they're taking care of themselves. But we get to make a difference, and so with that love that we get to share with them, man, they came out of the house, both of them, the husband and the wife, and they both got cleaned up. They both felt very comfortable to sit in our van, right? everything steriled and cleaned up, and get the help that they needed. They didn't want to go back to the hospital, right? They don't want more bills. How can I pay those when I don't have the money to pay them, right? But if we can bring this, in which we are, right? It's making a difference in their lives, right? It's opening up the fact that there's a humanity out here today that's alive. The chivalry is still alive. Love is still here, right? Even in the darkest spots.
Thank you.
Yeah.
Thank you, Scott. It's the little things, but it's also the big things, like the people who are here in this room right now. At a time that Dr. Lisa Cleveland said that like harm reduction wasn't a thing, right? 10 years ago in the medical field. So I next will ask you both as medical professionals. I actually consider all of us here as medical professionals of community. And actually, with that being said, I will shout out Yanawana Obladios, where y'all at tonight. Yes, we love our street medics. And I remember one time they made a serum for me for my anxiety and my stress. And they wrote my name with a heart on the bottle. And it tasted so good. And I took it every morning and I felt better. But with that being said, what can we do? What can the people in this room do that showed up for the future of harm reduction in the state of Texas? What does that look like?
I'll go first, but I won't talk long. I think it's about going to Austin, right? It's about testifying. The fact that syringe service or syringe exchange, syringe services programs are only legal in Bexar County in the state of Texas is, in my opinion, criminal. I know it's being done all over Texas, but it's being done with a risk, and there should be no risk. It should be legal everywhere. People act like this is something new. Syringe services, there's so much evidence. People say, we need to study it. No, we don't. We know it works. I mean, it's been working for decades. It works in other states. It works in other countries. It works. So the fact that that people are doing it in this state, with a risk, that's I have a really hard time wrapping my brain around that. So go and testify. That was the whole point.
Yes, I totally agree. Speaking up, microphones are terrifying for me. I'm facing down my fear to be up here tonight to talk to y'all. But yeah, we went in August. Scott and Madeline, a bunch of us spoke, and it was really scary, but it was really amazing, especially to see the response to, I went up there and tried to be as official as I could, and, told some stories of some people that I was there to share that, there was no way that they could have been there themselves. And the response that I got was like nothing compared to those who spoke from their lived experience and shared what they've been through, what they've overcome, and what people just like them need on the day-to-day to be well and get better. There were tears. The Public Health Committee of the House of Representatives were in tears, just so moved and so touched. And, we've seen some movement on getting fentanyl test strips being legal, being able to have drug testing technology so that people know what they're using and they can make healthy choices with what they're choosing and needing to use to stay well. On the 15th, February 15th, there's a state advocacy day. So a lot of us are going up there. There's a meeting on the 8th at 3:00 to talk about that. So if anyone's interested in participating in that, please come talk to us after, to either Madeline or to me, and we can get you on the list to be able to participate in that. If you want to go show up at the Capitol, there's going to be there's a rally. There's also going to talk to individual legislators. And so, yeah, that's one opportunity that's coming up soon. It's through the Texas Harm Reduction Alliance is doing the organizing for that. So there, you can get on their newsletters, keep up with what's going on with them, and find other opportunities to speak up. And yeah, please, if you have stories to share of yourself, your family, share those, and make sure people understand the importance of all of this. Break the stigma. Just talk about these things. Help people get past their fears, because you'll meet people who are like, yeah, but I'm worried, I think maybe this could be enabling, and okay, well, let's talk about that. We don't want to just blow those people off. We want to engage and try to say, okay, let me hear, what are you afraid of? Everything goes back to fear or love, right? So if we can get to that fear and then help them connect with the love and see, oh, okay, I do want that person to be well, so let's do what we can to get them there. Just connecting to that compassion that we're all born with, that we all carry. It's in all of our hearts. And it's just a matter of remembering it and kind of allowing ourselves to get past the fears, to feel that and live with that. So we can all help each other get there. That was us. Sorry.
Yeah, and just to second that real quick, I had a very similar experience. So I do think lived experience is what needs to be heard. I had a very similar experience 2 years ago. I still laugh about it. We went to testify, and it was related to recovery housing for women and children. One of our mamas who graduated our recovery residence, Casamia, she came along with me. Here I was in my UT Health white lab coat, and I had my fact sheet, and so I get up there to testify. I'm going through the facts, and they looked so bored, so bored and annoyed. Sophia started talking. You could have heard a pin drop in that room. She talked about what it meant to her to be able to recover with her children and not to lose custody of her children, and you could have heard a pin drop. So definitely, it is. You are the constituents. You vote legislators and you can vote them out. So they want to hear from you.
So I'm hearing testifying. I'm hearing legislature and testimony. And, I'm going to provide my personal opinion because no one asked. And that's why I'm here tonight as your lovely host of Black Freedom Factory. But I also will say that I have a very close family member who struggles with opioid use. And it was, and I feel very privileged to say this, and I feel very shameful to say this, but I really encourage getting vulnerable in a space. It was until someone that I was close to was impacted by substance use, that I identified as we. Before then, it was them. And in panel moderations like this, it's easy to say them. It's easy to say they. But the truth is we're all on the right side here, which is the future of harm reduction. And so I just encourage in the space that we say we, because we're not free until we're all free, and their struggle is our struggle, and no one is in front of or behind, we're only next to the other. And so, so long as my family member is struggling with substance use, which is something that this universe created, I will also struggle with that, and so therefore we are one. So I just wanted to provide that insight. Thank you. But our next panel question is for you, lovely. It is about how stigma has contributed to the HIV and AIDS epidemic. How you've seen that sweep across decades. How we can be better. Especially as our communities identify as trans, non-binary, inquiring, right? How have we seen stigma
and within harm reduction, right, impact communities that are living with HIV and AIDS.
Well, like I mentioned earlier, in 2018, I was diagnosed Kaposi sarcoma, which is full-blown AIDS. I had lesions all over throughout my intestines and my stomach, and I was eating, but I was starving myself to death because my intestines and stomach were completely coated with lesions. I was getting no nutrition, so I was starving myself to death. I was bones and hanging skin, and that was all because I did not want to go to the doctor. I did not, it was also pride. It was definitely pride and ego and my delusion of the way I was living and who I really was. But that was all rooted, if I think about it now, it had to do with these, like I said earlier, these shapes that didn't fit in the exact container. And I don't think that, whether it was 1960, because I was having all kinds of sex in the 80s. I didn't get HIV until 2017, 2018. I'm not sure exactly when. But it was because of being so in my addiction that I didn't care what needle I was using. I thought I had all clean new needles, but that was not a priority to me. The priority was getting high. So stigma today versus stigma back then, I honestly don't think it's changed very much because we still are very hush-hush about it. I don't think it's changed, but that's why these spaces are so important so that we can learn, and I give you permission to share my story, okay, that HIV doesn't kill anymore, and it's best to know rather than not to know. We have to get tested. We have to go in and the bear, it's ironic. I moved here from Chicago in 1991, and as a volunteer, I would go to the San Antonio AIDS Foundation and volunteer like Mr. Goody Two Shoes in my addictive delusion, even then, right? But when I contracted HIV AIDS, I had the biggest fear of walking in there and needing the services. That's how stigma impacted me. I could not walk through that door. It took, it took like 3 different people to say, please go to San Antonio AIDS Foundation. I was like, I can't go. Those people are going to know me. They know me. That's stigma still today. So has it changed much? I don't think so. But that's what the value is in these spaces and in these types of forums so that we can, like I said, you can steal my story and share it with whoever and say that these things still happen and let's talk about it. If you don't know anything about it or you don't know anybody, you can get a hold of me because of those little QR codes that are on your tables. That's a program that I work for, little PSA. But no, stigma still exists today. It is why I got so sick. And why many are getting sick. People won't walk into the doctor today and they have these horrible wounds because they fear walking through something that is, potentially going to get them in trouble. Walking into a doctor's office or walking in and how we're going to be treated. My own infectious disease doctor, he's professional. And he never told me about the different organizations that were out there to help people like me. And I think that had a lot to do with probably his license, and they can't really be favorites. But I went back and I told him, I was like, you told me I had Kaposi sarcoma. I had no idea that was HIV. I had no idea. And I wasn't a researcher. I never have been. And that's my fault. But I think the stigmas of the conversation being so alien and not normal create these areas of, even people who are licensed and doctors, and they have licenses, and I understand and respect that, but there needs to be a bridge so that the conversation is smooth, even with your own primary care doctor or a specialized doctor, where it's okay to say certain things. It's okay to say, do you understand what that means, rather than just give the antidote or give the diagnoses and then the antidote. Okay, here's some medication, you're going to be okay. And that was the biggest lie, because I started taking medication and I got real sick. So, I as far as the HIV world, I mean, and now, there's lots of benefits to what we have today in medicine. Absolutely. But so then there's like that subculture of within the community. Oh, you have HIV. It's still very stigmatizing. People don't want to share that. My partner, that one of the first conversations we have to have is, hi, my name is Steven. By the way, I have HIV. Because if you don't, then later on, so why didn't you say something? And it shouldn't matter, but that's all rooted in stigma. It's all rooted in, and that's all rooted in fear. And a lot of, I know for myself, the fears that I lived with caused all of that. Okay. No one's responsible other than myself, not my parents, not the way that I was brought up, not my doctors, not anything. It was rooted very deeply in my fear and what I thought was a solution. And like I said, like a rocket scientist, I thought I'd just self-medicate and pretend like nothing was wrong. And today I get the opportunity to speak out. So I started to get healthy, and I went on Facebook. I wasn't on Facebook ever. I went on Facebook just to shout it from the mountaintops that HIV doesn't kill anymore. You can recover from Kaposi sarcomas. Recovery is important, and is it all of those things, because I didn't see anybody else doing that. Now that I've looked, remember I said that I wasn't paying attention for about 40 years of my life. So when I started actually looking and paying attention, I saw that there were other organizations and people doing this work. I'm just grateful to be able to see it and recognize it and be a part of it now. But stigma still exists, and it will continue to exist if we don't talk about it and we don't bring up our reality or the reality that you just heard tonight and share that at home and talk about these things that will normalize the conversation. I remember like one time I was at the Whataburger, and I would, talk out loud with HIV. I went to go get this, and as a peer recovery coach, I try to make it very normal and very, very natural. And no kidding, these two, and I was actually kind of proud of them. These two elderly people, I guess they were husband and wife. They came over and they said, "I thought you could die from that." How, and so I said, well, I really appreciate the question. But that's just a nod to the ignorance that's out there. Still, now these people were much older than I. I'm no spring chicken, but they were much older than me, and so they only knew what they knew. And so if we don't talk about it, people aren't only going to know what they know. So I'm not here to judge anybody for not knowing. I'm here to be that ally to help educate and share my experience so that, A, the conversation can be normalized, and B, the stigma and the barriers are broken. To answer your question?
More than enough. Can we get? And you know what, Stephen? We wish you 40 more years. We wish you 50 more years. We wish you 100 more years, because we're talking about it tonight. God dang it, aren't we? We are. We're talking about it tonight, and I know for a fact that more importantly, and I'll share this. Like I said, nobody asked for my opinion, but here I am moderating. When monkeypox arose, we saw a parallel stigma, and it was just this, like, I think MSNBC posted this, like, gay community transmitting this thing. And I'm like, I don't understand that, because if you have skin, you can literally transmit monkeypox. If you have sex, you can transmit HIV or AIDS, right? And so I think stigma starts there. It comes with recognizing that a certain marginalized community is associated with a virus, or associated with poverty, or associated with a terrible stigma that we're forced to outlive. And the reality is that we cannot outlive these stigmas. So thank you so much, Stephen, for your perspective. My next question is for Monica. What medical concerns do you have pertaining to the population that you serve? What concerns do you see on the horizon? And we're approaching our mixer hour here, so thoughts.
What's our mixer hour?
Our mixer hour is a time for all of us to mingle in the building, because we all are doing necessary work in Bexar County to combat, right, this thing that is very normal. So
awesome. Yeah. Okay. So medical concerns for the people that I serve. So it's access to medical care completely. So I work with people who are experiencing homelessness in our street medic program with Yanawana. And getting, yes, there's access to an ER. But the stigma that they face when they go into the ER is horrendous, and it is such a barrier that it prevents people from seeking. I've seen people die. They'd rather die sometimes than go to the ER and be treated with no dignity. So that is enormous. We as medical professionals have a huge responsibility to shift that culture in the way that people are treated. I was an ER nurse. I was constantly yelling at my coworkers to be like, what if that was your sister? What if that was your brother? Like, the things that people say, not even stepping away from the patient sometimes. It's not okay. It's also a failure of that system, that the healthcare system overall is not set up to meet people's needs. It's a profit-driven industry. So we're not able to work in a way that is actually taking good care of people in a holistic sense. So, it's set up to fail. And so all those, those coworkers who are treating people poorly are overworked. They're trying to take care of their families. They're barely eating and going to the bathroom themselves. So yes, there's many systemic problems. So the problems that the people are facing in terms of their health is the social determinants of health. We need housing. We need clean water access. They need a bathroom to go to publicly. We need, being able to wash our bodies to prevent infection, environmental determinants like that. Sure, yes, also medicine, but preventing these things, having healthy food to eat, clean water to drink, clean air to breathe. All of this is, the essential elements to health. And they are our birthright as living animals on this earth to be able to live well. And so I truly believe that, there's so much that doesn't make sense that's getting in the way of people being well. It's after working in Haiti for so long and then coming here in the land of plenty and seeing people, dying of preventable things, when we have all of this, it's a disgrace. I've seen people do more with less in Haiti, and be able to take care of each other in a community in times of disaster. And, be able to, okay, let's figure out how are we going to get water? How are we going to make sure that people are fed? People, have make it happen day to day. And so here, we're just all very distracted and going about our lives. But we have people, our neighbors, who just need the basics, and changing our systems so that people have access to these things needs to happen. You have to have an ID to be able to access medical care in a lot of our county funded health programs. Even if you've already been a patient there, to go back to get, for our people on the street who need their psych medications, who want to access that, want to go back to see their doctor they've already seen who's prescribed them their medicines. Oh, you've lost your ID because your stuff gets stolen every other day on the street. You can't come in and have your appointment and get your medications. There's so many needless barriers for our people. It's like, I don't need an ID to go to the doctor. Like, I don't have to show my driver's license to get medical care. There's so many needless barriers that are set up that we can do better. We can fix things. I went and observed a program in Austin where a nurse practitioner, a medical assistant, and a case manager were doing mobile primary care. So they go out into the woods and there's some people living there and they're like, hey, does anyone need medical? And they're like, oh yeah, I've got this problem. And so they walk up, oh, okay. So the case manager says, okay, what's your name and date of birth? Oh, okay, so your MAP, your county funded health program is inactive. All right, so let me get you going. Okay, by the end of the day, you're gonna have that health coverage. So that's great. And so the nurse practitioner's next, the MA is taking their vitals, checking on their, basic health needs. And they say, oh, okay, so it looks like you have Bell's palsy. I'm going to prescribe you a steroid. It's going to help, with this facial paralysis you have. Do you want to, so I'll send it to that HEB over there. They're like, yeah, that's great. Well, actually, no, they kicked me out of that HEB. So if you can send it to the other one, it's a little bit further. Oh yeah. So, okay. So yeah, they close at 8. So your prescription should be there. I go around 7 o'clock. You can get that tonight. So that's possible, just right in our own state. Like, it's not a Medicaid expanded city, but they have their county funding these things. That is through the Healthcare for the Homeless grant. It's a federally qualified health center that's providing that care. So it's my dream and vision that we have that ability here in San Antonio to go out and provide a funded, holistic, comprehensive primary care program where people can, get what they need. We can go to them since they can't come into these institutions that are, putting up these needless walls. So yeah, there are solutions to these problems. Humans created these systems and humans can change them. We are humans. Let's do it.
Thank you so much, Monica. And yes. And this is honestly such a stimulating conversation. I'm a fan of not talking at, but talking with. So this is the portion of the panel where anyone in the room, I also encourage BIPOC, trans, non-binary individuals who do not have access to health insurance to ask our panelists questions about the future of harm reduction or any pressing questions that they might have pertaining to their individual experience. Not all at once. Yes, I see Light, the CEO of Free Texas, who works with formerly incarcerated individuals who she deems as scholars, and her program offers recidivism with San Antonio College, as well as education for folks who are re-entering society who are formerly incarcerated. Leonora Light, please come and share your thoughts.
First of all, I want to say thank you for this conversation. As you said, it's been a stigma for many years. Myself, I am a national peer support specialist, and I remember you in Haven for Hope. That was where I came from too. But I wanted to share one thing I realized when I was working at the Josephine Clinic. We have a lot of people that have dual diagnosis, mental health, and they also have addictions. But they can leave. So the cycle just continues. So they come in, they want to receive help, and then they get medical services to some extent, but they leave. and they have that option to do that. And a lot of them have such severe mental health issues that when they're leaving, they don't know they're leaving because they've already left in some aspects. So what are y'all thinking about that aspect of it when we're talking about, the health and the hospital division of that too? And then another quick question too is, I am a big believer in harm reduction. I have a great friend that was a heroin addict. And when she didn't get the right needles, big boils, what happened in her arms and a lot of pain. What are some of the things that you feel as community leaders and people that are wanting to do more and help, what can we do to help out, to figure out how do we make this, like you said, not just a Bexar County thing, but a state nationwide type of thing that needs to be done. So just with the Josephine, people coming in and out, needing these services and not being able to have the same ability. Because one thing I realized myself is I wasn't able to get services until I got incarcerated. And I think that's the big issue that we see more than ever, is that my mental health and addiction was not addressed until I was deemed no bail, no bond. So how are we going to start stopping this cycle of chaos that has been induced by systems? And how are we going to actually start working together as community leaders and people in general? What do you see would benefit more? It's a lot of questions, but whichever one you like.
Do you want to start? That's a tall order. Those are really, really challenging problems. And, so much of this, I think, goes back to the way we used to treat individuals with mental illness. They were locked up against their will, horrible. But then we went to the other extreme where now people are just turned out with no place to go. They're not well. I lose sleep at night thinking about, because so many of our unhoused citizens are suffering from really serious mental illness, and they are so vulnerable to somebody taking advantage of them, somebody hurting them. I don't have an answer to that. Having access to mental health care services, period, would be a step in the right direction. And you're so right. I mean, our jails, our prisons are the major sources of mental health care in this nation. What does that tell you? We're locking up people who are not well. And people who are not well mentally tend to get into trouble, right? And so they end up in jail. It's completely messed up. So I don't have any answers for you. I think it's going to have to come from a policy, from a place of policy, and it's just going to take not giving up, going and insisting that something be done, because it's not getting better. It's getting worse.
So I was thinking of the concept of housing first, and being able to, so not just housing. I mean, it has to be a completely holistic approach. So it takes all of us working in all the niches that we're all working in to try to create, a society that's supportive of people having their needs met. So if someone, if the conditions don't change, then people aren't going to be able to change, what they're seeking. So someone's got to be ready. They've got to feel safe in order to say, okay, I'm going to take a risk and try something different. I'm going to trust this provider that wants to give me this medication, or, even seek that care. So, I just think safety in our communities has to be there. So yes, housing, people having a consistent food supply, getting out of survival mode in a way, to be able to think a little bit longer term, and for their own self-interest. And so yeah, it's tough, and it just takes all of us, continuing to do the day-to-day things that we're all trying to do, to make that difference. This is a culture shift, like our society's gotten we're in a pretty rough spot. Like it's pretty bare bones right now. Like what's available for people. This is a harsh world right now. So we're just, all trying to build back together and create the world that we want to see. and have those conditions so that people can access what they need and are feeling safe to take that risk and try new things.
Yeah.
My director is wanting to answer the abscess question though. So we got homies with abscesses and wounds on their body. What do we do? How can we help? Right? So we, as Corazon, we're privileged to have a free medical clinic that's been in operation since 1999. And we're so thankful for that clinic because you don't require an ID, no money, no insurance, and they will help you with your dermatology needs, primary care, and psych meds, all for free. And so I would encourage you to tell your friends if they do have abscesses, right, to go to the Corazon Clinic. It's twice a week on Wednesdays and Sundays. It's all volunteer medics, nurses, med students, nursing students that will take care of them. Every Wednesday at 4:30 and Sunday morning at 8 a.m. at Travis Park Church. Sundays we do hot meals and showers in the morning. And so I would encourage you to connect them with street medicine, right? There's the San Antonio Street Medics you can find online. Connect them to Yanawana Herbolarios. They have obviously an amazing medical director, but connect them to somewhere that they'll be able to get that treatment with dignity and compassion. Don't bust those abscesses with a needle. They do it. Don't pop it like a pimple with dirty hands, right? Our people, they're dying because those infections are getting into the bloodstream and killing them. Right? So be cautious about doing wound care on clients, but make sure that they're doing it with sterile and clean supplies. Connect them to our clinics. Just wanted to say that.
Thank you, Mara. Yes, Doctor. Just to add to that real quickly, as part of harm reduction, oftentimes safer injection practices are taught. I'm certainly not an expert in it, but our very good colleague and friend Kevin Irwin teaches it routinely when he teaches harm reduction. So I think those are some ways to try to prevent some of those abscesses from beginning.
And you know what, right? Because I proudly proclaim that I am an abolitionist, I will say that we need to start writing letters to people who are incarcerated to tell them that we care about them and that we remember them every single day in the United States of America. Also in terms of prenatal care, right, and folks who are born addicted to a substance, we understand that folks who are presently incarcerated as well as formerly incarcerated are subject to higher instances of infant mortality as well as infants who are born with addictions. So with that being said, I think how we can harm reduce is to remind the people who are stuck in these systems that we're dispelling and that we're rebuking that they matter and that we love them and that their babies matter, and that we're working actively to reduce the harm that they see on the inside and that we see on the outside. So any other questions for our lovely panelists? Yes, hello, please.
So thank you for having me here. So my name is Liberty Serna. I'm a recovery support peer specialist with New Seasons. So when we talk about stigma, so many things cross my mind. So working in a treatment facility, an outpatient treatment facility that provides methadone, buprenorphine, you know, we work to get these people off the streets and into treatment. And these patients expect to get service and support in these treatment facilities. And as a recovery support, I recognize stigma. I see it. I see it within those counselors that we're entrusting to spill our personal business out there. And so I want to thank all the recovery support specialists, all the advocates, and everyone else for what we're doing here, because it is something that needs to be brought to light. and I mean, I have so many questions, and I know that we have more questions than we do answers, but just the fact that we're stepping out and doing these kind of things, is very, very important. One point of bringing these kind of meetings to the clinics and not just out into the streets, but to professionals and letting them know that we stand as people who support harm reduction and that we're not going to stand for the stigma inside clinics. Another topic is so I'm a person in recovery. I struggled with methamphetamine for a long time. As a result, the custody of my children were taken away. So CPS is it's a personal thing for me, okay? I understand that CPS is there for, to protect those who really need to be protected. But on the other hand, we do have a big stigma inside the DFPS. So I just want to bring that out to light. If that's something we haven't already thought about, that's another stage, another direction where we can take this and start discussing stigma with Child Protective Services, which usually has their doors closed to us. But in order for us to make a change, we have to make what I call noise. You got to make noise. And so just keeping all these things in mind, because if we think about it, what you do here, what Corazon Ministries is about, it's about treating those that are homeless. Where did the homeless people come from? A lot of them came from foster homes. They came from foster homes, and as soon as someone's released from the foster care services, what did they tell them? I don't know, just go to the Haven for Hope. Where do I go? Where do I go from here? I'm aged out. Where do I go? I don't know. You got to figure it out from here. That's majority of our population out there. So if you pay attention to the revolving door, the revolving money maker is Child Protective Services, because what's happening is our patients, they're not wanting to, they're feeling stigmatized, so they're going to hide from CPS. So their children get taken away because of something as simple as stigma, something that we could address. And I know it's a big thing, but we're going to start here. And these patients, then the children get taken away. Same process, same revolving. Here they come, they're homeless. Now we're doing the same thing again. So it's not just about bringing the awareness into the streets. Just remember, it's in the clinics, and speak up. They're depending on us to be that voice. Okay. So thank you.
Thank you so much. So I really appreciate that. Thank you so much for your testimony. I want to pass it over to Stephen. I feel like this was a very action-oriented comment, right? What work are you doing with the South Texas Overdose Prevention, and what program do you have in place known as Stop Overdose?
Thanks for allowing me to talk about the program. So I get, one of the coolest things that I get to do is I get to share my experiences I've mentioned earlier with others, and that has brought me to, an incredible, like I've been getting blessings before I ever really realized what was happening. And so the work that I do today, I get to work at University Health, and I work in the grant and research department, and I work for Stop Overdose. On your table is a little QR code, little business card thing. I encourage you to go there. It'll direct you to, that QR code will direct you to a full panel of all the links to Facebook, Instagram, some of the other ones that I'm not a social media person. So, but any place that will give information. You can get a safe sex wound care that's been talked about a lot. You can get Narcan. You can get a sharps disposal container. You can get all of those things in one kit, or you can pick out what you want. So and I know Corazon does all that. But if you're sitting here, take that with you and give it to someone or order it for someone. It's good to know that there's access to it. It will be delivered to your home. It will be delivered to the people that need it, that feel the barriers or feel the stigma of walking into a place like this. As sacred as it is, it still does present stigma for some people because I do not like that. I'm not like those people. I'm not that bad off. That was me. So I encourage you to take those business cards that are on your tables, give them to people if it's not for you because you have resources, that's fine. But I think one of the most beautiful things is, and the program Stop Overdose is for Region 8, which is 28 different counties in Texas. So it goes as far as Del Rio, it goes as far as Laredo, it goes as far as Eagle Pass, and a little further north in here. And so we can offer those services. I've had some clients in a different program that were in Del Rio. We couldn't help them. Well, this program we can. And again, it's just about talking. It's about having a resource for people. We will have a website after this, what you see there on the different social media platforms, we're having a website created as we speak. And so all of the education on what stigma is, what harm reduction is, and how to get connected to a peer recovery person. If you're out in a rural county, I mean, they don't even know what that is. I lived here and I didn't know what that was. So, it's all about education. It's all about breaking those barriers. And I just get the privilege of being able to work. And that work is actually what built this bridge with me and the relationship I have here at Corazon. I have the privilege of, and earlier it was asked, what can we do? Show up and volunteer. Okay, come here and volunteer. Help Abraham, help all the things that need, all the little packets that need to be done. That is all done by our hands. It doesn't come from China done, okay? Right? So if you want to do something and you feel like you have a few extra hours anytime, show up. They won't. I don't think they'll turn you away. I've fought some pretty shady people myself, including myself. So please show up and volunteer. And thank you so much for letting me have this opportunity to talk about the program.
Thank you so much, Stephen. Let's give it up. Let's give a round of applause for our lovely panelists tonight who give their lives to harm reduction. Before the hour, we are going to just kind of go down the line. I see we're exchanging information. That's my favorite form of doing things. But just tell folks where to find you. Tell them who you are, who you're with, and we'll get it popping. I see that we have one more question. I'm not someone to deny a question. Yes.
If ever need anybody to speak up,
to be fair, it's not really so much a question, more just like kind of a statement. I'm a person who uses drugs. I have a history of an experience with housing insecurity, food insecurity, discrimination in medical settings. I have been homeless in multiple cities across the United States. Like I said, I'm a person who uses drugs, so I'm not somebody who's in a period of abstinence currently. I'm somebody who continues to use drugs, although I have had periods of abstinence. And I'm I consider myself a career harm reductionist, although I've never ever in my life been paid for harm reduction. And so like, regardless of whether I was on drugs or not, I have always been a harm reductionist and I've always practiced. And I try to get involved in harm reduction, like where I can, even if I'm both receiving services and also providing services. And so I just wanted to mention, I know that it was mentioned a couple times, like, to say we rather than them, because I know in the first, maybe the first 15 or 20 minutes, I did hear they and them and the community, and I'm sitting right at this table here. And I'm a person I'm the person you're talking about. And so I just wanted to say that I'm really, really grateful. I could cry right now. I came here from Philly 10 months ago. I'm no longer homeless, which is which is a blessing, even though I'm not sober. But I have been homeless many, many times. And I'm super, super grateful for that. But I really appreciate the fact that I have the ability, the autonomy, the privilege to share with other people who are also somebody who uses substances, that even though I'm not sober, I don't have to die in the street. I don't have to rot in the street. And there's nothing wrong with 12-step. Like 12-step changed my life. I've had periods of abstinence through 12 steps. I honor 12 steps. I respect the 12 steps, but I am not somebody who's sober currently. And that's okay. And I don't have to be homeless. I don't have to rot. I don't have to die in the streets because I'm not abstinent. And I just wanted to say thank you so much.
Thank you.
Because I've been like I said, what I consider a career harm reductionist in Philadelphia. There's a group called Operation in My Backyard. South Philadelphia Punks with Lunch, North Philadelphia Punks with Lunch, Conquer Crew. There's a lot of Prevention Point, which does syringe exchange services. I was involved in all of those communities when I was in Philadelphia as an active using drug user. And I've been back in Texas for about a year now, and I haven't been involved in harm reduction, which has always been like something that kept me tethered to like this plane of existence, whether I was on substances or not. And it's not something I've been involved in since I've moved to San Antonio about 8 months ago. So I'm very, very grateful that you guys had this panel tonight, and I'm very grateful to be here. Thank you so much.
I'm so sorry. What did you say your name was?
My name is Tori.
Thank you, Tori. Can we please thank Tori for their testimony? Can I hear us say we? We. Can I hear us say we? We are a community. We love you. And you do not have to be clean to matter. You do not have to be abstinent to matter, because you matter and your testimony matters, and we're so grateful for that. Thank you so much. Thank you, Tori. Thank you for everybody who attended tonight. Thank you to DreamWeek San Antonio for allowing us to dream. And thank you for everybody in this room for kicking down that damn barrier and saying DreamWeek means harm reduction, because it does, period, in the city of San Antonio, Bexar County, and the future of the nation. Dr. Lisa Cleveland, where can we find you?
Oh. After this, or? Well, at the Health Science Center. So I'm at the Health Science Center School of Nursing.
Dr. Monica, Nurse Monica, how can we find you?
Oh, you got one right there. Oh, that's better. Thank you.
Dr. Monica.
Dr. Nurse.
Dr. Nurse.
So contact-wise, you mean? So through Yanawana Herbalarios, Facebook and Instagram is our most up-to-date info. I'm also on Instagram. I'm happy to give out email, phone number if anybody wants to stay in touch. Yeah.
Awesome. Thank you. Stephen, how can we find you?
Well, I have cards with my phone number. You can go to the QR code and ask to speak to a peer recovery support person. That would be me. And yeah, so you can get me there. I give my personal cell phone number to everybody that wants it, needs it at any time.
Thank you. We have about 5 minutes left, y'all, in the night. Please feel compelled to approach our panelists if you're all comfortable to talk to them and know how you can get in touch with them and their resources. Thank you to Corazon SA, Gavin Rogers, CEO of Corazon SA.
Guys, give it up for Camilla Factory. Okay. She has hosted about 4 of these things throughout DreamWeek and various panels and hopscotching around the city, 5. And her voice is an important voice, one of the most important voices in our community for the many years, the past years now, with clarity and with consistency. So thank you, Camilla, for always doing what's right.
And yeah, we out here. Also, condoms, lube, tampons. That's a form of harm reduction too. Valentine's Day is coming up, and sex is liberated. We out here, but be safe. Thank you.
Ladies and gentlemen, thank you for coming. If you would just put your trash where the trash, please think about yourselves. I know you're not like, the people that come here during the day. I love you all.